Good day, Philippines!
Magandang araw, Pilipinas!
Today's special report focuses on common communicable diseases and their prevention. Communicable diseases continue to affect millions of people worldwide, including many Filipinos. While some illnesses may seem common, they can become serious if not prevented or treated properly.
It is an illness caused by an infectious agent that is transmitted directly or indirectly to a well person through an agency and a vector or an inanimate object. Fortunately, many of them are preventable through proper hygiene, healthy lifestyles, vaccination, and early medications.
We are your news anchors committed to promoting health education and empowering every Filipino through accurate and reliable health information. Your health, your future, our commitment.
Balitang tama, kalusugang alaga.
I'm Haley Zion Estera.
And I'm Ethan Gabriel de Jesus.
This is Balitang Kalusugan. Our reporters are stationed to discuss 4 common groups of communicable diseases, their symptoms, how they spread, and most importantly, how we can prevent them.
Let us begin with respiratory infections. Samantha, tell us more.
Thank you, Ethan. Respiratory infections are one of the most common illnesses that affects the parts of the body involved in breathing, including the sinuses, throat, airways, and lungs. Common respiratory infections include the common cold, influenza or flu, COVID-19, pneumonia, tuberculosis, and chickenpox. Let's talk about chickenpox. Common symptoms are mild fever, body malaise, and itchy rash of dark red pimples from the trunk to the face, scalp, and lips. The pimples develop into blisters, then scabs which drop off after 12 days. These diseases are usually caused by viruses or bacteria and spreads through respiratory droplets when an infected person coughs, sneezes, talks, and even laughs. Touching contaminated surfaces and then touching the eyes, nose, or mouth may also spread infection. Common signs and symptoms include fever, cough, runny nose, sore throat, body weakness, and difficulty breathing in severe cases. We encourage everyone to practice proper cough etiquette by covering the mouth and nose when coughing or sneezing, washing hands regularly, wearing a mask when feeling sick or in crowded places, maintaining good ventilation indoors, and receiving recommended vaccines can greatly reduce the spread of respiratory infections. Remember, staying at home when you're sick also helps protect your family, classmates, and community. Healthy lungs means a healthier life. This is Samantha Flaminia reporting for Balitang Kalusugan. Back to the studio.
Thank you, Samantha, for briefly explaining respiratory infection. Let us now discuss gastrointestinal infections. Vikizo, you're on.
Thank you, Estera. Gastrointestinal infections affect the stomach and intestines. They are commonly caused by viruses, bacteria, or parasites found in contaminated food or water. Symptoms include diarrhea, vomiting, stomach pain, nausea, and fever. Example like amoebiasis, it is an infection in the bowel, particularly the colon, characterized by diarrhea. This infection can be fatal in infants and to older people with low resistance. The main risk is due to dehydration from loss of fluid. The best way to prevent these infections is to thoroughly cook all raw food, thoroughly wash raw vegetables and fruit before eating, reheat food until the internal temperature of the food reaches at least 167°F, and do not forget that part of the microwave cooking process includes careful instructions of the standing times to ensure the food is completely cooked before it is served. Remember, practicing good hygiene is one of the easiest way to protect yourself from gastrointestinal diseases. This is Janana Vikizo reporting back to the Angkor.
Thank you, Vikizo. Now we have Nicole Noblejas to tell us more or to discuss vector-borne disaster. Nicole?
Thank you, Ethan. Vector-borne diseases are illnesses transmitted through insects known as vectors, particularly mosquitoes. In the Philippines, dengue fever remains one of the most common vector-borne diseases, especially during the rainy season. Other examples include malaria, which is an infectious disease caused by the presence of parasites in the red blood cells. This disease is transmitted by mosquito bites. People infected with these diseases may experience high fever, severe headache, muscle and joint pain, skin rashes, fatigue, and bleeding in severe dengue cases. One mosquito bite may seem harmless, but it can carry viruses capable of causing serious illnesses. Fortunately, prevention is possible. Communities are encouraged to eliminate stagnant water where mosquitoes breed, empty water containers regularly, cover water storage, clean drainage area, and wear long-sleeve clothing when necessary. And lastly, apply mosquito repellent. Remember, by keeping our surroundings clean, we also protect our families and neighbors.
Because animals and humans rely on each other so much, this contact can enable diseases to spread between them. Mosquitoes, fleas, ticks, and sandflies are parasites to animals and humans. And when these parasites spread microscopic organisms, they are called vectors. Diseases like Lyme disease, West Nile disease, Leishmaniasis, and Dirofilaria repens can infect both animals and humans. When an infectious disease is shared between different species, like humans and animals, science calls this zoonosis. Scientists around the world recognize the importance of companion vector-borne diseases and the role animals have in the spread of these diseases. Science even says that 75% of emerging or re-emerging animal diseases can also affect us. And because the health of humans and animals is closely linked, public health experts are working together to focus on companion animal vector-borne diseases under the One Health banner. Through the concept of One Health, healthcare professionals and policymakers can plan new strategies to protect against the diseases that spread between animals and humans to keep everyone healthy.
This is Nicole Sinoblejas reporting back to the studio.
Thank you, Nicole. Lastly, we have Janelle Latada to explain what is sexually transmitted infections. Janelle, you're on.
Thank you, Haley. Our final report focuses on sexually transmitted infections, commonly known as STIs. These infections are primarily spread through sexual contact and may also be transmitted from mother to baby during pregnancy or childbirth. Some infections can also spread through contaminated blood or shared needles. One important fact is that many people with STIs may not experience symptoms during the early stages. Making regular screening is very important. Possible symptoms include pain during urination, unusual discharge, genital sores or rashes, and pelvic pain. If left untreated, STIs can lead to infertility, pregnancy complications, and other serious health problems.
There is a greater risk of passing the disease on to others unknowingly, because sexually transmitted diseases initially do not cause symptoms.
Prevention includes practicing responsible sexual behavior, using protection such as condoms, avoiding sharing needles, getting tested regularly, and seeking immediate medical care if symptoms appear. There should be no shame in seeking professional healthcare. Early diagnosis and treatment save lives and prevent further transmissions. Awareness, education, and responsible decision-making remain our strongest defenses against STIs. This is Janela Tada reporting. Back to our anchors.
Thank you, Janelle, and thank you to our reporters for today. Before we end today's news, here is Lazel to talk about some quick health reminders.
Here are today's healthy living tips. Number 1, wash your hands frequently with soap and water. 2, eat balanced and nutritious meals. 3, drink enough clean water every day. 4, exercise regularly. 5, get at least 7 to 9 hours of sleep. 6, stay updated with recommended vaccination. And number 7, keep your surroundings clean and seek medical attention early before sleep. Remember, prevention always starts with you. Thank you, Lizelle Benicisto. Today's discussion reminds us that communicable diseases may spread easily, but many of them are preventable through proper hygiene, healthy habits, and informed choices.
We believe that educating the community is one of the most effective ways to promote health and prevent diseases. Every small actions, whether washing your hands, keeping your community clean, or seeking medical care early, can make a big differences.
We hope today's Balitang Kalusugan has not only helped you become more aware of the importance of disease prevention, but also the importance of personal responsibility in protecting public health.
Thank you for joining us today.
This is Balitang Kalusugan, your trusted source of health news. Stay informed, stay healthy, and remember, prevention is always better than cure.